Welcome to The Spill. It's season 3 of The Spill, episode 1. In this episode, we'll be talking to a medical doctor about cervical cancer. So stay tuned. And thank you so much to our sponsors for this episode. Dr. McIntyre, welcome back to The Spill.
Yes, thank you for having me back.
You are the first repeat guest that we've had on The Spill, and I know the last time you were on The Spill, it was a very popular discussion. It was a well-received discussion. We're talking about miscarriages in that episode. But today, we have a different topic at hand. It is January, and this is Cervical Cancer Awareness Month.
That's true.
And when it comes to women's health, women's reproductive health, cervical cancer is definitely an issue.
On top there.
Very high on the list that we need to discuss. So, Dr. McIntyre, I wanted to start off with first you just telling us what is the cervix. Mm-hmm. We're talking cervical cancer, but what is the cervix? Where is it located? What is the significance of this part of the female anatomy?
I agree with you. So in order for us to understand the disease on a whole, we should understand where the function of what it is. Mm-hmm. Okay, so to begin, the cervix is situated in between the vagina and the uterus. So basically it's like a gateway, a pathway, if you would say, that allows passage from the vagina into the uterus. Okay? So the functions, which are numerous, but the main functions would be acting like a passageway.
Okay.
1. 2, it's great for pregnancy. Pregnancy in the sense that it enables a woman to maintain her pregnancy because it stays closed. At that time, produces certain mucus that causes a plug that causes to prevent bacteria or viruses from entering and also maintaining a pregnancy.
Okay.
It also acts like a passage for the sperm for fertility and those things there. Menstrual cycle, it helps the passage of the menses to get out through the vagina. So the cervix is very important, especially the mucus and the glands that are there. So that's where it's located.
So it's that doorway, essentially.
Passage.
Yes, a passage, entry, exit.
Yes.
And you mentioned maintaining a pregnancy, and I guess women that have had babies would know when they're delivering or before they deliver, we start talking about the dilation of the cervix.
Yes, that's true.
So it has the ability
to... If the cervix is not dilating,
no baby passing out, right? So it does have the ability to expand.
Yes.
When
definitely
birth is happening. Okay. Mm-hmm. So this important aspect of the reproductive anatomy, the cervix, what then is cervical cancer? What could that be defined as? And what would be the symptoms of this form of cancer?
Okay, so cervical cancer. Mm-hmm. Cancer of the cervix.
And some people say cervical. Is it either way?
Semantics.
Okay.
So it's based on your pronunciation of certain words. Okay, so cervical cancer. Cervical, or people may want to say it.
Okay.
It's all based on you. But it's what can it be misconstrued is if you're talking about
the neck.
Yes.
Okay.
So that's important to note.
Okay.
So cervical cancer is cancer within the cervix, right? We have 2 types. Mm-hmm. We have the squamous cell carcinoma, which is one of the most frequent one you have, up to say 70%. It would be that one.
Okay.
Then you have the adenocarcinomas, which is much more difficult to detect because they are located a little higher up in the cervix. The squamous is a little lower down.
Okay.
The adenocarcinomas will more be a glandular cancer as compared to this squamous being a more cellular because of the mucous membranes there at the point where it's being affected. Now, cervical cancer is abnormality of the cells over a prolonged period of time.
Okay.
It's not a cancer that is for tomorrow. It's a progressive cancer.
So it takes a long time to develop.
It takes a long time to develop.
Okay.
Okay. So in the inability to diagnose it is not there. The ability is there.
The ability is there.
So the onus is on individuals.
Okay.
Okay. So the tell signs would be irregular menstrual cycles, heavy bleeding during your menstrual cycles, bleeding in between cycles, the odor, the type of blood that may be coming out, painful sexual intercourse.
Okay.
Okay, and even pain after intercourse. All those tell signs that you should have yourself checked. Not necessarily that you have
cervical cancer,
but you should have yourself examined and assessed properly before you do anything or go further.
Right. But some of those things you mentioned, Dr. McIntyre, to be honest, a lot of women experience a lot of these things, maybe for varied reasons.
That's why I say you should have yourself assessed.
Yes. So I mean, you spoke about irregular menses and pain and you know, or heavy bleeding.
Yes.
And these things I know women speak of very frequently.
They do.
Very frequently. So how then would cervical cancer be diagnosed?
Well,
what is your diagnosis process?
That brings us to pap smears.
Okay.
Okay. Pap smears is the number one screening tool that helps you diagnose whether or not you are precancerous cells, meaning that if you have any abnormal cells, be it low grade or high grade.
Okay.
Okay. And this enables us to do, or warrants us to do further diagnostic testing to see if we actually need a biopsy. Now, a biopsy is taking a sample of that tissue that's infected or looks weird and be sent to test to see whether or not it's staging for any form of cancer or just some irregular cells because irregular cells do happen because of how the cell is divided at a time. Certain forms of inflammation can cause it to look weird.
Okay.
Like you having probably a bacterial infection, a yeast infection. That in itself can make it look weird. So it doesn't mean because I have inflammation, my cells irregular means I actually have
cervical
cancer.
Okay.
It just means that these cells has to be further tested. Sometimes it warrants you doing a further pap smear test.
Okay.
Or based on the findings on that one, person who is consulting you might actually tell you, okay, so we might need to do a further test, which is probably a colposcopy, where you are viewed on the microscope, like a binoculars, to see whether or not there's any tissue that is looking irregular. And then a sample of that is taken and sent to be tested.
Okay. So let's backtrack a bit. We mentioned some of the symptoms of cervical cancer. We're saying here that the cancer can be diagnosed or precancerous stages can be seen through the screening method of a pap smear. Who is most at risk for cervical cancer? Or maybe I should ask, who should be screened?
Any woman who has a cervix is at risk.
Okay, so
woman.
we have
if you have a cervix, you should be screened. You should be screened. Simple as that.
Dr. McIntyre, what about women? And I know many who have never had a pap smear and think maybe, you know, for some reason they are not at the age that they should have one, or is there any you know, qualifying factors in terms of age or behavior for screening?
Now, mention risk factors. Now, the risk factors would be number one factor on the table would be HPV.
Okay.
Human papilloma virus.
Okay.
Okay, that is the number one factor. Second factor, smoking. Smoking is a risk factor. And then immune problems. Okay, if you're immunocompromised, it increases your risk as well.
Okay.
And then we likely suspect if you have a strong family history of cervical cancer.
Also, that factors in as well.
Yes,
Okay.
that factors in as well.
Okay.
So, as you say, backtrack to number one, the main one, HPV. HPV is one of the most common and most frequent STD that is out there. Now, it's asymptomatic in the sense that it doesn't really show symptoms, but because 150 to 200 strains of the HPV virus. Right. So we have different ones that will cause an increased risk of actually having cervical cancer.
Okay.
So he's screening for that. So one of the symptoms that you may see is actually genital warts. And also with the pap smear test, you can actually see whether or not HPV is present. Okay, so still goes down to pap smear. And I like the remark that did to HPV again is that promiscuity increases the risk
of having HPV.
Yes.
Okay.
College students, that swims in university, HPV.
Okay.
Yes, to be honest with you, you see a increased risk of it like that.
A high rate.
Yes,
Okay.
a high rate of it there.
But so an increased risk with promiscuous behavior,
Yes.
but not the only reason why you may have an HPV infection.
No, so that's why I mentioned it, because people may think, okay, well, I'm not promiscuous, I'm not having sex, I'm by myself in a corner.
Yes.
Are you smoking?
Okay.
Increases the risk.
Okay.
Do you have a family history? There's a risk factor. You being a woman.
Right.
That's
the biggest one.
So no, there is no reason you shouldn't get pap smear done because you think as if you don't fit the criteria based on those factors. And in this day and age, not one woman should die of cervical cancer. We have the screening methods.
But people may wonder though, if, and this topic is particularly interesting to me, I will confess that, I went through a lot of issues with first of all, not wanting to do pap smears, then having it done, finding irregularities, being treated. Someone may think, okay, this screening method will say whether you have a precancerous, manifestation, or whether you have cervical cancer. But what is the use in finding out? There are people who would think, what is the use in finding out? If I have it, well, what can be done if somebody does present with precancerous or abnormalities that are found on their pap smear?
Important to note the word precancerous. Precancerous means pre. Doesn't mean you have cancer at all.
Okay.
It just means that the cells are irregular and may lead
to cancer.
Because I said to say it's a progressive disease. So if these irregular cells are not treated, they will go on and on and on until they become that cervical cancer that you will be diagnosed with after a while. So no, the precancerous cells that you may find in a pap smear, it does not warrant you to feel like as if, I don't want to know. I'm scared. You could be treated and live a long life rather than leave it there and live a short life.
So what is that treatment like?
The treatment, there are different treatments. Okay. Based on the level of staging precancerous, the results are there. We have different methods. We have sometimes what you call cautery. Where you then the transformational zone of the cervix, it will go back. You're just getting rid of the abnormal cells that are there. Okay. You have a laser treatment as well. You have a large loop electrical where you work like a cone biopsy. You remove that infected area and you allow the new tissue to grow. And then you continue your pap smears.
Okay.
This also helps with staging whether or not you actually did have cancer or you actually don't. Because it may look like that, but when you take a biopsy and you send it, it just was probably a chronic inflammation that you're having, rather than I actually have cancerous cells.
Okay. So when we talk screening, the pap smears, we're saying, all categories of women should have a pap smear. Is there a particular time in your life that you stop doing pap smears?
No.
So your recommendation is to continue?
Once you have a cervix,
Okay.
because one of the other symptoms or tell signs again is postmenopausal bleeding, meaning that you have left your menstrual cycle, your postmenopausal, but you're still having irregular bleeds from time to time.
Okay.
That will require further diagnostics. Okay? So if you're regularly doing your pap smears, even after you have stopped seeing your menstrual cycle, it will tell. You're not supposed to have bleeding, unless if you probably have a polyp or something that may be causing that. Okay, like they're saying you will have cancer once you after menopause, you're bleeding. That's not what I'm saying. That's why you have to be assessed properly, see your physician, and get feedback as to what is the best mode of treatment. Okay? So the bleeding there at postmenopausal is one of the things that you should monitor. So it's just getting checked properly.
Okay. I want us to take a closer look at the local picture as it relates to cervical cancer. But before we delve into that, I want to take a short break just to take a few words from our sponsors, and then we will continue the discussion. We want to get into the local picture next. Dr. McIntyre, we are back. It's episode 1 of season 3 of The Spill, and we are talking cervical cancer. We left off, with we're aiming for the local picture of cervical cancer. We're in Dominica. How big of a problem is cervical cancer? How prevalent is it here? And what have you been seeing?
Okay, to be honest with you, the cervical cancer issue here for population size, I think it's high. Okay? I'm calling in terms of population.
Okay.
In terms of how much people infected. The issue is not with that. The issue is that with our screening methods, we are able to detect things rather very early.
Okay.
So we are not reaching an alarming rate of cervical cancer because people are being screened. They're taking their pap smears a little bit more serious as times go on. That's why the awareness is very important.
Okay.
Because one generation might be aware, but the flow of information and being educated is a continuous medical education
that's correct.
that you have to hand on to the new ones coming up, the 13-year-olds to the 16-year-olds coming up. Okay? So that in itself will help prevent the whole cervical cancer. So it's not alarmingly high, but it is there. And the awareness is one of the things that we try to do to push out there to educate people as to cervical cancer. So seeing that we have done that, it has cut it down tremendously.
Okay, so we've seen some progress there.
Yes.
And who is impacted the most in terms of age group? What are we seeing in terms of that and cervical cancer? Okay, so
the topic cervical cancer, let's take it off the table just so let's put a pin in it up there. Okay. Let's go straight to the source, straight to the problem which can cause it to happen. So if you understand the root of the issue, you can have a better end result. Now, promiscuity issue, because one of our main problems is the HPV
virus. Okay.
Yeah, so the HPV is, as I said, a university, but don't take it to layman's terms. Actually, it's university. It just means promiscuity in the sense that you engage in sexual intercourse unprotected with numerous partners. But you yourself might just have one partner, but your partner might have numerous partners, which increases your risk. No, it being asymptomatic, no symptoms at all, or probably have genital warts. You have no idea because the average person is afraid of knowing exactly what's wrong with them. And they're afraid of being screened. And especially as we say in local, our communities are so small. We can easily be told, someone told, hey, this person has that. And then you are afraid. You are ashamed. So those are the stigmas that are attached with it that gives you the issue. So the demographics of it is once anybody engaging at the age of 16 years go up having multiple partners or one partner has multiple partners, increases your risk of having cervical cancer. So you should start having your pap smears at an early age.
Okay.
22 years go up, you should start having your pap smears.
Okay.
And guidelines say that if you have an irregular pap smear, you don't have to do it every year, every 6 months. You every 3 to 5 years you can do it. And as you get older, you don't have to do it every year unless it warrants it.
Okay, based on your results from previous pap smears. Okay. So we're bringing in certain,
Touchy
factors here.
factors.
Yes. So we're talking about, the women who may be impacted by cervical cancer or who may, be at risk for cervical cancer. What about, a lot of times cancer in general is seen as something that affects older people. Is
true.
this true for cervical cancer?
No.
Okay, so
No.
what's the picture
Once
here?
you increase risk, once you hit 30.
So are people in your, to your knowledge, diagnosed in their
my
20s, in their 30s?
Yes.
Okay.
Yes, I've seen it.
Okay.
28 go up there, I've seen it. The youngest I've had is probably 30.
Okay. Okay.
And and at that stage, it was aggressive. Okay. So which leads to another aspect of the show, the staging of cervical cancer and what it means for the survival rate or the prognosis. Okay. Cervical cancer has like 4 stages, and each stage has a different subgroup within it. It all depends on where the cancer is located, where it be just in the cervix, spread to the nearby organs, spread to the lymph nodes, and stuff like that. And each stage warrants a different type of treatment.
Okay.
So one would ask, can it be treated?
Yes.
Can I be cured?
Good,
Early
important
detection.
question.
Early detection.
Okay.
Pap smears, screening, early. If I have early stages, which is just confined to the cervix,
Can be treated.
can be treated. Hysterectomy.
Okay.
We remove the uterus.
Okay.
The only offside is that you're no longer bearing capabilities.
Okay.
You won't be able to get pregnant again. So that is one of the treatment that you receive, but it depends on the early stages, early diagnosis. Okay. Stage 2, stage 3 kind of becomes problematic, where you might have to go through chemotherapy, radiotherapy. Okay. And that in itself would be very troublesome.
Okay.
And if we're speaking locally, the capabilities of average Dominican getting that kind of a chemotherapy and radiotherapy is difficult, because that means you will have to travel abroad.
To go abroad. And then costly as well.
That is where
the cost. Yes. Okay.
Yes.
So that's prohibitive. So we're looking at early detection, of course, being the ultimate way that we can have efficient treatments,
Totally.
or treatment that will
Yes.
be curative.
Yes.
Yes. Early.
With cancer, early diagnosis is the best way.
Okay. Okay. So I'm going to take a step back to HPV. People with young children might have heard about the HPV vaccine.
Yes.
I know this program exists locally. Do you have any, information about how this vaccine is helping with the prevention of HPV? And I know locally it is given. Do you know if it's a successful uptake? I know, for instance, with COVID vaccine, we had a lot of vaccine hesitance, it was called, or vaccine fears. What about the HPV vaccine?
With any vaccine, it's a personal choice. That is a very personal thing. That is a decision you have to make. And it has gotten a lot of blast when it just came out as to why do I need it? It doesn't cause any symptoms. It doesn't kill me. It increases the risk.
Of cervical cancer.
Yes.
So at what age is the vaccine being given?
You start as early as 12 to 15.
12 to
And
15.
sometimes
Okay.
in incidents you can see at 9 years.
Okay.
Yes.
Okay.
So over the period of time, people have asked, how old can I get the vaccine? Am I too old to receive the vaccines? Those are questions that are asked by the public. One of the things that is important to note is that from 12 to 15, yes, it's early because that's before you're actually sexually active.
That's
Before
the
you
hope.
actually sexually active.
Yes.
Because the world we're in there, a lot of things happen. So you cannot account for someone's sexual habits. Okay? But yes, that is when before it actually happens. So you actually want to get the vaccine before
The
you're
onset of
exposed
sexual activity. Okay.
to anything.
Okay.
And as late as 26 years.
Okay.
But in recent times, you have seen them open to up to like 45 years.
Really?
Yes. No, the reason for the gap and saying it doesn't really work for, or they were more focusing on young ones before the actually onset of sexual intercourse is because the older you get, the increased risk of being exposed. So does it make sense to receive it? You understand? But if someone is practicing a safe lifestyle, abstinence and stuff like that, they have decreased risk of getting it via sexual intercourse. So why not protect yourself against the other factors that may be there?
Okay. Okay. So interesting, because I do know that there is a lot of, thought about when can I get that vaccine and,
Yes.
what age can I be and still get
Still
the
get it,
vaccine and
yeah.
let it have some sort of impact. So that's interesting.
These are two-dose vaccines. So
Okay.
that's like a COVID.
Two
As you
doses.
said.
Okay.
Yeah.
Okay. So, Dr. McIntyre, I want us to, really bring the discussion to a head. And let's just talk about prevention. It's a lot of the things you have said, I just want us to put it in clear focus. How do we prevent cervical cancer? We spoke about it being diagnosed. We spoke about what are the symptoms. We spoke about early detection. But is there any, solid advice on prevention?
Prevention. Well, before prevention, let us go into our risk factors.
Okay.
Risk factors: HPV. Practice safe sex.
Okay.
Have one partner. Or abstain. Okay. So that is one of the prevention.
Or be
methods.
vaccinated if you a younger person
If
and you
you're-
can. Yes.
Well, the vaccination is the onus on the parents.
Okay.
Because at 9 to 12 years old,
You're not making that decision.
you can make that decision for yourself.
Right.
You don't. And that is one of the other factors. When the child grew up, would the child wanted to get that vaccine?
Okay.
But you got your measles shots.
Measles, mumps, rubella.
Do you regret getting them?
No.
So it goes on the parents at that time. And then when you're older, 20s going up, you're an adult,
You can make
you
that
can
decision.
make a decision on your own.
Okay.
So I would really push it in there
Okay.
as a preventive. Yes, it's a preventive, but that's on your parents. But you as a person.
So
yes.
safe sex practices,
Safe sex practices.
abstinence if you choose.
If you choose. Yes. That is on our first factor. Second factor, smoking. Leave that alone. Smoking has
Drop
nothing.
it.
Smoking has nothing good to the body.
Okay.
If you show me a study that shows it has something good to the body, I'd like to read it. You understand?
Right.
The smoking, because three factors, you have the smoke, nicotine, and the tar. I haven't seen none of these three things had anything positive to the body.
Okay.
Okay? No, don't get me wrong. I said smoking, smoke, tar, and nicotine. Those are the three things I'm targeting. Because people might misunderstand what I'm saying.
Okay.
Okay?
Okay.
The other thing that we touch on is immunocompromised people.
Yes.
And when I say immunocompromised, is those like HIV.
HIV positive
Yes.
people. Okay.
If you have HIV, have yourself screened regularly.
Okay.
Because it increases your risk. So it's you had an increased risk, so your prevention is having yourself screened properly.
Okay.
And then our other factor being genetics,
Family history.
Have yourself checked.
Okay.
Simple as that.
And I guess know your family history too.
No,
ask questions. Yes.
Go to
Yes.
if you do not know what questions to ask, go see your physician. Your physician know the questions that they're gonna ask, and then you realize I am totally blank about certain things. So then forces you to go home and ask your parents,
Right.
or your close relatives.
Right.
Does anybody have this in our family?
Yes.
So it increases your awareness as a person, because some of us just get up and go out the door and go over to a merry way until we get sick, and then we ask the questions. Guaranteed, a lot of people do not know their blood type.
That's true.
Which is
That's
very
true.
important.
Yes.
Okay.
That's true.
So yes, so those are the preventive measures. So it's about breaking down as to your risk factors and how you target them to make sure you're okay.
Okay. So, it is Cervical Cancer Awareness Month, and this is observed globally.
Yes.
And, we really just want to increase the awareness.
Definitely.
Surrounding cervical cancer, the preventative methods that you outlined, the importance of screening. And I think you were very clear.
Screening.
Yes, very clear on that.
Have your pap smears done. As I said earlier on, and I would like to enforce it, is once you're a woman with a cervix, you're at risk.
Okay.
I don't try to frighten you. Don't get it wrong. But it's a reality that exists.
Right.
Okay, and life we're living. If you do not take charge of it, who's going to do it for you? You're adults right now. If you're a kid, like they said, to the vaccination, parents take care of that.
Right.
But your pap smears is when you're an adult.
Right. And just for information's sake, for our listeners, our viewers, where can these pap smears be done?
Pap smears.
Do you do pap smears?
Well, yes.
Yes. Okay. and where else? So people can go to a private physician.
People can go to the private physicians.
Where else can they access pap smears?
Their pap smears through their health centers
right,
as well.
In the public system.
The public system provides that there. Certain institutes like this.
Planned Parenthood
is definitely one that a lot of people visit.
Yes.
Yeah, I heard the nurse there is very nice.
Yes, so Planned Parenthood. Yes. So it's always good because sometimes, just like when we talk about anything else, people might be like, well, I'm hearing the doctor saying I need to get screened, but where do I go?
Yes, where do you go?
Where do you go?
But, and this is awareness month, so a lot of places are offering these services.
Yes.
I myself am offering, if you didn't do the pap smear by me, I'm offering like a consultation on your results.
Okay.
So it's not a matter of just doing the pap smear. The pap smear have to be read by somebody.
Right.
And explain to you what exactly we're gonna do, what kind of treatment we're gonna do.
Right.
So I myself, providing those services.
Nice.
Because I'm passionate about what I do. Quoted from my grandfather. Love what you do, you never work a day in your life. I love what I do.
I can see.
Okay. So I've always been driven to be there.
Okay.
To be able to take care of women.
Yes. Good, and that's a good mission, Dr. McIntyre. So I wanted to open that up so people can know. I know the last time you were on the spill, you were one of the more popular guests on the spill. So the ladies know now, in terms of their pap smears, their cervical cancer screening, where they can go, and that you are also, offering.
I'm always available.
Right, and offering that service. I think this wraps it up for our discussion here on the spill. I thank you so much for joining me.
No, thank you.
Joining me on this episode. I know the viewers will say, when is Dr. McIntyre coming back? So just stay tuned to the spill, in future episodes. You never know. Dr. McIntyre might be back on the spill talking about something else related to women's health. So thank you.
Thank you.
Until next time.
Yeah, sure.
you so much for looking at this episode of The Spill. And thank you to our guest, Dr. Shane McIntyre, for sharing his expertise with us on the topic of cervical cancer. Thank you to our sponsors for supporting this episode of The Spill. Now remember, if you liked this episode, and I know you did, please make sure to share it with a friend or family member so that they can learn more too. Remember, Women's Health Plus. Like, share, subscribe.